So, in this lecture, we are going to cover acute severe hypertension. We can call that as hypertensive crisis. So, hypertensive crisis, in chronic hypertension, the threshold and target is 130/80. Threshold and target may be 130/80 in majority of patients. So, you have to get the blood pressure of 130/80 and below. But in hypertensive crisis, each situation is different. So, it is easy for us to select drugs and treat chronic hypertension because we have a particular target, particular threshold at which we have to start the drug, and we know which conditions we have to use the drug, and majority of people the target is fixed and the drugs are proven there. Whereas hypertensive crisis is not so easy because each situation has got different threshold of treatment of hypertension, different targets, different drugs, and the time frame in which you have to reduce the blood pressure. So, everything is different for each one of the conditions. That's why hypertensive crisis is not so easy as treating an acute chronic hypertension. Moreover, you have to decide all this in very rapid speed because the patient is very ill when the patient has got hypertensive crisis. And the second most important point is, we are not so familiar with parenteral antihypertensive drugs as we are for oral drugs. So, that also complicates the matters to which drug to be given and what dose to be given and what titration should be given and what will be its action after stopping the drug and so on. So, we are not very familiar. Because of these reasons, the hypertensive crisis treatment is not so easy. So, first we will unravel the terminology confusion. So, the terminology, what is hypertensive crisis, what is hypertensive emergency, what is hypertensive urgency, what is malignant hypertension, what is accelerated hypertension, and what is hypertensive encephalopathy. So, we will see one by one. Hypertensive emergency is the one where you have blood pressure, systolic blood pressure more than 180, diastolic blood pressure more than 120 with a acute clinical end organ damage and clinical presentation. So, the patient with 180, 120 presenting with acute pulmonary edema or ischemic stroke or acute kidney injury or papal edema will come under hypertensive emergency.